Right in the heart of Pakistan's capital, there's a medical school that's shaping the future of the nation's healthcare, one student at a time. So today, we're going to take a closer look at the Federal Medical and Dental College, or as most people call it, FMDC, to really understand what makes it a cornerstone of medical education in the region.
Excellence in medical education and healthcare. Pretty straightforward, right? But you gotta wonder, in a country with some really complex health challenges, what does excellence actually look like on the ground? This motto, well, it's kind of our launchpad for figuring out the high standards FMDC sets for itself and for its students.
Okay, so how does a place like this really operate? We're going to pull back the curtain and look at its history, its academic setup, and its pretty ambitious vision for healthcare, all from its prime spot right there in Islamabad.
All right, so the college doesn't just see itself as a school. They use the word beacon, and that's a powerful word, right? It suggests a guiding light, not just for the students walking its halls, but for the entire healthcare system. The idea isn't just to churn out doctors, but to really forge professionals who can lead with both incredible skill and, just as importantly, compassion.
But to really get a handle on its impact, we've got to start at the beginning. You know, the basics. So let's dig into the facts that really define this institution.
All right, let's get down to the essentials. The who, what, where, and when. Basically, the DNA of this college.
Okay, so check out these dates. FMDC is actually a really young institution. I mean, it was established in 2012 and then formally set up by Parliament just a year later. This means it was built from scratch to tackle today's healthcare challenges without being tied down by, centuries of old traditions.
And this is a key point. FMDC is a public government-run school, and being in Islamabad, that's not just a random spot on the map. It's super strategic. It puts them right at the center of the nation's healthcare policy and all the regulations.
110. That's the number. Just 110. Now, in a country that needs a ton of doctors, that might seem like a small number. And that's because it's a very deliberate choice. It really points to a philosophy of quality over quantity. The idea is to create this really focused, almost intimate learning environment where every single student is seen as a major investment.
No medical college can do it alone. FMDC's credibility really comes from its key affiliations. It's part of the Shahid Zulfikar Ali Bhutto Medical University, and, this is a big one, it's recognized by the Pakistan Medical and Dental Council. These aren't just names on a website. They are solid guarantees of academic quality and professional standing.
Okay, so that's the foundation. But what's it actually like to be a student there? Let's dive into the curriculum itself, where all that textbook theory gets hammered into real-world, hands-on clinical skill.
So yeah, it really all boils down to this question, doesn't it? What exactly are these 110 students learning day in and day out that turns them from just students into actual doctors?
So here you see the absolute building blocks of any medical education. You've got everything from anatomy, which is like the map of the human body, all the way to pathology, which is this deep dive into the microscopic world. All of these subjects, they form the scientific foundation that every single clinical skill is built on.
But let's be real, you can't learn to be a doctor just by reading a book. The real test, the real learning, happens when you have to apply that knowledge in a hospital with real patients and, real stakes. That's the bridge from theory to practice.
And this is exactly where FMDC's location is such a massive advantage. See, students aren't just stuck in one hospital. They actually get to train in two. They're exposed to all these complex, specialized cases at PIMS, that's the biggest hospital in the capital, and then they get that core, hands-on training at the Federal General Hospital. That mix of experience is absolutely critical for their development.
Okay, having a tough curriculum is one thing, but how much is an FMDC degree actually worth out there in the real world? Let's talk about recognition. We're talking about the official stamps of approval that make this a degree that opens doors, not just in Pakistan, but potentially all over the world. So, inside Pakistan, FMDC has the two most important seals of approval you can get. Getting recognized by the PMDC, well, that's non-negotiable if you want to practice medicine, and its link to the Ministry of Health just cements its status as a top-tier federal institution. Now, for any graduate thinking about a career outside of Pakistan, this next part is huge. Being listed in these major international directories, like IMED and the one from the World Health Organization, means an FMDC degree is recognized globally. It travels well. It's basically a passport to postgrad studies and jobs all around the world.
Okay, so we've put all these pieces together. The history, the curriculum, the recognition, but what's the big picture? What's the ultimate vision here? What's the philosophy that's driving all of this? Let's take a look at the future that FMDC is trying to create.
And really, who better to sum up the mission than the principal himself, Dr. S.H. Wakar? Just listen to the words he uses. Beacon of excellence, competent professionals, highest standards. He's basically circling right back to that core mission we saw at the start. It's all about that perfect mix of tough academics and practical, hands-on clinical training.
And that brings us to the ultimate goal. All of the teaching, the learning, the research, it all funnels down to one single powerful idea: to serve society. The endgame isn't just about creating new doctors, it's about lifting up the health of the entire community.
So, this is the question FMDC kind of leaves us with, right? When you focus so intensely on quality instead of quantity, and you tie everything you do to this mission of public service, what kind of ripple effect does that have? How can one single college, right there in the capital, really change the future of healthcare for a whole nation? It's definitely something to think about.